Let me introduce Lobby Akinnola from the Covid-19 Bereaved Families for Justice group, which I mentioned. And firstly, I'm so sorry because you lost your dad, Femi, last year.
Good morning, Jeremy. Thanks for having me. And yes, I lost my dad in April last year to COVID.
Well, there are two schools of thought. One is that it's so important we find out what went wrong that we need to start now. And the other one is to have a proper inquiry. We need to do it. And we need to wait until the pandemic is really over.
I would personally lean towards the idea that we need to start now. I think waiting until the pandemic is over to learn the lessons to, help us deal with the pandemic seems somewhat counterintuitive. Why wait till the game is over before you start trying to figure out how you can win it? And I understand that, we need to make sure that the resources and people are there to deal with the pandemic itself. But I'm more concerned about the fact that if we're just going to repeat the same mistakes we've made before, those resources are being wasted. And this inquiry is going to have a very broad scope. Is it going to necessitate everybody at all times being present? I think that it makes sense to start the inquiry now. And as people need to be dealing with the pandemic, if you have doctors that need to be serving, ministers who need to be going to meetings and making decisions, they can be excused to carry on with those duties and just return to the inquiry. As we've all noted, it's going to take a long time. I think if there's one thing we've learned in this pandemic is you can't ever move too soon.
Yeah. Just in terms of Femi, your father's death, where are the areas you want attention? Tell us about the circumstances and what questions you personally want answered.
My dad was a key worker. He worked with people with learning difficulties, and he was working throughout that first wave of the pandemic. He called 111 a fair few times because he didn't have any underlying health conditions. He was told to just kind of stay at home to recuperate, and unfortunately, he didn't. He died, and it raises questions for me and my family and things like, where was things like PPE and where were the support for our key workers in that first wave? My dad took his winter gloves and scarves to work to try and protect himself. So he had the insight or the foresight to be like, this is a virus, I need to try and protect myself. He's not a medical expert. Like, why was he not able to get the resources he needs to look after himself? And then also, I have the question of how appropriate were services like 111 in dealing with a novel virus? We have something we hadn't seen before in this country. And to have people, effectively be diagnosed, because we didn't have testing then, to be diagnosed over the phone. Again, they're not as aware, they're not medical experts, they can't speak to how severe the symptoms are, and people are just kind of following a potential questionnaire to ask questions. Okay. And for me, lastly, is questions about how able we to notice the symptoms in people of color. As we've seen from all of the numbers coming out from this pandemic, people of color have been disproportionately affected by COVID. And there's things like, when my mom called up to get tested, one of the questions she was asked was, are her lips blue? So it's just, are we fundamentally, do we have the right questions, the right tools to help us deal with COVID at the start? Did we? And then Understood. Did we learn from those mistakes and make sure that people in color are also accommodated for, the unique presentation the symptoms might have?
Thank you very much. So that's Lobby Akinnola from the Covid-19 Bereaved Families for Justice group. Lobby, thank you for talking to us about your dad.